This week is Valley Fever Awareness Week in the state of Arizona. The proclamation was made earlier this year by Arizona Governor Jan Brewer. Joining me on the phone to discuss the fungal infection valley fever is Dr. John Galgiani. Dr. Galgiani is a professor of medicine at the University of Arizona and the director of the Valley Fever Center for Excellence. Hi, Dr. Galgiani, and thanks for talking to me today.
Yes, good morning.
Great. All right, so this week has been declared Valley Fever Awareness Week in Arizona. For my listeners here in Florida who may not be aware, what is valley fever and why is it of such importance in your state?
Valley fever is a fungal infection. Its medical name is coccidioidomycosis. It's caused by a fungus that lives in soil in certain parts of the Western Hemisphere, typically in deserty areas such as the Southwest and South Central Arizona, Central Valley of California. The valley is named after the San Joaquin Valley or the Central Valley of California, but with the increasing population in Phoenix and Tucson, there is now over twice as much of the problem in Arizona as there is in California.
Okay, and so you mentioned that it's an issue in the Southwest. So we're not going to see this in Florida or New York or states like that.
Well, it's not endemic to those states, but you will see it because, as you probably know, people travel. And we estimate that probably every year roughly 1,500 people who visit Arizona for whatever reason return home and then get sick shortly after that. It could be that the doctors in those states won't think of valley fever unless the patient tells them they recently were in Arizona and that they have a problem with valley fever in that state.
Is there any certain population that is more at risk than others?
Well, actually, anybody who lives here has the risk of getting infected. There are examples of clusters of cases. There's been some in the news this year. I think there was an outbreak of a number of construction workers in California and San Luis Obispo coming down with this when they were installing some solar panel equipment. But that's actually the exception. Most people don't have a particular risk other than that they've been in the endemic region. There is a risk of some people after infection having much more complicated disease. And the most important risk factor there is whether or not they are immunosuppressed for some reason, such as having organ transplant or immunosuppressing treatments for their rheumatoid disease or AIDS, those very heavily immunosuppressing conditions. Sure.
And as far as the treatment, is the available treatment for coccidioides pretty effective?
Well, some of the good news is many people who get infected actually get over it eventually on their own with their immune system controlling this. A small percentage of people really do need treatment, and there we have drugs to do that. Unfortunately, the drugs, although they are useful, do not actually cure the infection. They suppress the growth of the fungus. So in some cases, people have to stay on treatment for the rest of their life. So there's certainly ways we could improve on the current state of affairs.
Sure. Let me switch gears a little bit. You're the director of the Valley Fever Center for Excellence. What exactly do you guys do, and what's the mission?
Well, the Valley Fever Center is part of the University of Arizona program and was approved by the Arizona Board of Regents back in 1996. And we first started increasing the number of people doing research on this disease in laboratory work. But since then, we've also tried to increase awareness, such as this being the 11th year of the Valley Fever Awareness Week program. And more recently, we established a clinical center in partnership with St. Joseph's Hospital in Phoenix, which is the right place to have a center because most of the infections in the state are actually in the Phoenix area. So we see patients there now and also use that as a hub to refer patients to doctors across the state who know about this disease.
Fantastic. And let me go ahead and close with this last question. You said this is the 11th year of the Awareness Week. What typically occurs? What kind of events do you guys have during this time of the year?
Well, we have public forums to discuss this with the general public. One such will be on Sunday of this week. There was one Monday in Phoenix. The one on Sunday is in Tucson. The one in Phoenix was on Monday. And we've actually had a special guest this year will be Congressman David Schweikert, who is interested in this disease because his district is Scottsdale and Phoenix, which is very involved with this problem. We also have more scientific programs to increase the number of scientists working on this disease.
Oh, fantastic. Okay, well, I've been talking to Dr. John Galgiani with the University of Arizona. Thank you, sir, for talking to me today and lending your expertise.